Welcome to Pharma Learning. In this lecture we will learn about Opioid Antagonist. Opioid Antagonist are agonist-antagonist in nature, or they have partial or weak agonistic action at opioid receptor. In agonist-antagonist, they are agonist at one receptor and antagonist at another receptor. Second, they are partial or weak agonist, which having very low INSTR/INSIC activity. These opioids are analgesic of limited efficacy, which is almost equivalent to low dose of morphine. This opioid antagonist are classified in 3 classes. First is agonist-antagonist nalorphine pentazocine butorphenol. Second is partial or weak mu agonist with kappa antagonist activity, and is buprenorphine. Third is pure antagonist. That is naloxone, naltrexone, NALMEFENE. Let's see individual drug detail. First, buprenorphine. It is partial agonist at M receptor with K and D antagonistic property. It is an alternative to methadone for the management of opioid withdrawal. Second, nalbuphine. They are kappa agonists and mu receptor antagonists. These drugs can produce psychomimetic effects with hallucinations, nightmares, and anxiety. Third, nalmefene. It is lacks in hepatotoxicity of naltrexone, also it having higher oral bioavailability and is longer acting. Fourth, pentazocine. Its profile of action is similar to morphine. Important differences are: analgesia caused by pentazocine is primarily spinal, kappa 1, and has a different character than that caused by morphine. Sedation and respiratory depression is 1/3 to half of morphine at lower doses. Tachycardia and rise in BP are produced at higher doses due to sympathetic stimulation. Biliary spasm and constipation are less severe. Vomiting is less frequent. Other side effects are sweating and lightheadedness. Subjective effects are pleasurable, morphine-like, at lower doses. Its oral and parenteral ratio is 1:3. Duration of action of a single dose is about 4-6 hours. It is useful in postoperative and moderately severe pain in burns, trauma, fracture, cancer, etc. Fifth, butorphenol. It is a predominant kappa agonist that produces equivalent analgesia but more sedation than morphine. Should be avoided in patients with cardiac ischemia. Its half-life and duration of action is similar to morphine. Then, sixth is naltrexone, which devoid of subjective and other agonistic effects and more potent than naloxone. Long duration of action is about 1-2 days. Decrease alcohol cravings, so helpful in alcohol withdrawal. High doses can cause hepatotoxicity. Seventh, naloxone. It is enolylnaroxymorphone and a competitive antagonist on all types of opioid receptors. It blocks mu receptors at much lower doses than those needed to block kappa or delta receptors. Intravenous route 0.40.8 mg promptly antagonizes all actions of morphine and also antagonizes the agonistic actions of nalorphine, pentazocine, etc. It blocks placebo, acupuncture, and stress-induced analgesia, showing involvement of endogenous opioid peptides. Half-life is only about 1 hour. It is useful for morphine poisoning. It reverses respiratory depression due to intraoperative use of opioids. In diagnosis of opioid dependence, aloes partially reverses alcohol intoxication. Thanks for watching Pharma Learning. Subscribe our channel for more videos.